didn't cover home sleep apnea testing, and we brought in someone who is part of a program that does an unbelievable number of home sleep apnea tests on a monthly basis. And I consider her to be an expert in this field as it relates to patients who are being tested in the home. So hang tight for the presentation and be ready to ask some questions. Maybe there's some things that you can learn from today's presentation that will help with your own home sleep testing program. Please welcome Allison from Virtuox.
Hi, good afternoon, everyone. Allison Hotaling with Virtuox. I currently serve as the Vice President of Home Sleep Testing with the organization. I've been with them for 12 years. We are a diagnostic testing company and treat patients or diagnose patients with obstructive sleep apnea and a variety of other diseases. So I think really the biggest thing is talking about home sleep testing and how that can help you all, whether what stage of this journey we're in, whether you are a student or you are a tech, an RT, physician, PA, anything like that. So I think really learning about home sleep testing and really talking about how to triage your patients for home sleep testing and really the patient's perspective. So I think first, one, I am disclosing that I do work for a home sleep testing company, but we're not really talking about my organization. We're talking about home sleep testing in general and patients. So first, really talking about home sleep testing sleep apnea and the prevalence of sleep apnea. I think we all do think about it from time to time, but you all probably know these numbers, but it's always something to be kind of bring up in your head because the prevalence is so large with sleep apnea. So approximately 54 million Americans have sleep disorder breathing. And we know that 1 in 5 people has mild OSA, 1 in 15 has moderate to severe OSA. OSA obviously affects 9% of middle-aged women and plus 25% of middle-aged men. So it is definitely something that is a middle-aged disease. So it's definitely, that we learned this morning. We should really be looking at it also from a pediatric standpoint. So it is something that affects all walks of life, but it is definitely more a middle-aged disease. And the prevalence of it is, somewhat similar to, say, asthma and diabetes. We know those two are extremely common diseases in the United States. 20 million people have asthma and 23 million have diabetes. And about 7 in 10 people with type 2 diabetes also have OSA. So we know that there's a very high correlation there, and we need to remember the prevalence of OSA and how many people it actually affects. So about at least 25 million adults have obstructive sleep apnea. And something to think about, only 1 million patients go on CPAP every year. So we have a lot of people walking around undiagnosed. Over 80% of the population remains undiagnosed. And why is that? It's a variety of reasons that they remain undiagnosed. We have to remember this is a sleep disease. Like we heard about this morning, our vet partners are so important. They're the ones that bring awareness. A lot of the time, it is a sleep disease. Patients are not always aware of the signs and symptoms that they do have. People are in denial. There's limited access to testing, limited resources, some things that we'll get into. But it's really about that we have so many people walking around undiagnosed, and it's really about the education and the awareness that we need to bring that. And going into kind of the comorbidities of it, we just talked about 7 in 10 people have diabetes, also have OSA, and over 30,000 people die from cardiovascular disease every year from untreated sleep apnea. And untreated sleep apnea increases risk of stroke by over 60% and heart failure by 100%. So those are very high statistics of what the impact that untreated OSA has. And again, 80% remain undiagnosed. So talking about screening, because that is really the heart of it. That's how we get to knowing if someone has OSA. Again, if someone is not bringing the awareness to it, and patients are not being asked these questions, we will likely never know if they have obstructive sleep apnea. And why screen for OSA? I like to say, let's get to the heart of the matter. So sleep apnea first part. When you look at the acronym, heart failure, elevated blood pressure, arterial fibrillation, resistant hypertension, type 2 diabetes, stroke. And why screen? Well, we know that early detection help improves, is the best form of prevention and treatment. It's a way to save lives. Again, lack of awareness. We are so unaware of sleep apneas. I know that we've all seen it. You literally talk to someone about sleep apnea and they have no idea what you're talking about. They've never heard of it, or they hear of it and it is, oh yeah, my uncle, my grandpa, someone has that. And they have very, very, very little awareness of what the disease actually is. And again, absolutely, they have no idea of the prevalence, and they have no idea thinking about the, the biology of everything and how it actually affects everything else within our bodies. So untreated OSA, we know can exacerbate current comorbidities and definitely can create new comorbidities. We know if we're treating and screening for OSA, we're treating for it, we're going to be decreasing hospital readmissions and lowering healthcare costs. Healthcare costs are obviously through the roof. We want to try to bring that down as much as possible by lowering hospital admissions and treating patients. And with prevalence such as diabetes, it's vital. And it only takes a matter of minutes. It definitely saves lives. So talking about screening itself, the screening is great, but when we look at some of the strainers out there on the market, and some of the ones that insurances require to be done in order to pay for, say, a sleep study and treatment, the patients might not understand the questions that are being asked, and these don't really ask them in a way that they understand. I think we have to think about literacy in this country, and not everybody is at the same literacy rate. We have people of all walks of life, so we really want to be able to relate to the patient and ask them these questions. Of course, legally ask them in the way you need to, but really ask them in a way that they can understand. If we say like things of dozing off after 5 minutes of eating, it's such a, we're putting so many words into things, and we really want to simplify it. So really, one, being involved in the process with the patient, never just hand them a screener. They're going to read it themselves. They're not going to necessarily understand it, and they're, again, so unaware of the signs and symptoms a lot of the time, and we're in denial. So we're going to say, no, I don't see that, and they're going to screen well, and they're not going to be on our radar. So it's really being involved with the patient and empowering them, have an open conversation of why they are doing their screener. Again, remember, it's a sleep disease. The patients are unaware of their signs and symptoms a lot of the time. And number one, the bed partner. So if they're bringing a bed partner, or bringing a spouse, someone in with them, definitely, if the patient's okay with it, involve that patient in the process. Involve that patient's spouse or bed partner in that process, because they're really going to be able to help answer those questions and get you the correct answer of what's actually happening. If patients can't answer certain questions or not sure about certain things, they feel comfortable bringing, screener home, talking to their bed partner about it. Definitely try to encourage them to do that and follow up with that. And definitely then really utilizing those screeners as a way to be able to properly triage that patient for the type of study that they're going to need, and being able to then get them to the best outcomes for therapy. So looking at the current US kind of sleep state, and some of these are current, these are stats and also kind of problems that we're facing in this industry. So currently approximately there's about 7,000 board certified sleep physicians in the country, about 2,000 to 2,500 sleep labs in the United States, approximately 15,000 registered polysomnogram technicians. We all know that COVID has changed the perspective of everything in this country. In some ways, the sleep industry absolutely grew. Obviously, it closed labs, but it made a lot of people very aware of their sleep. We now are taking on this new generation of people being more aware of their sleep. there are so many gadgets out there. There are so many wearables out there. There's a big difference between a wearable and a diagnostic. There are so many wearables out there that people are now caring more about their sleep and noticing things. So we're hopefully having more public awareness. But we definitely have, limited staff and resources, COVID concerns, lab closures. Real estate's expensive. A lot of people don't want to open a lab because it's expensive. They can do things virtually. They don't want to have large capacity facilities, beds, and stuff of that nature. So it's challenging. Lab supplies are expensive, and obviously we have insurances that we all rely on getting paid from. And so a lot of insurances at this point will push an HSC prior to a TSG. Large public unawareness for sleep apnea. On one hand, we obviously have people who do understand the importance of sleep and that's being on the rise, but there's still such a large public unawareness, and we still have such large rates of patients being undiagnosed. And technology is definitely on the rise as well. So talking about the patient triaging, about 85% of undiagnosed sleep apnea patients can properly be diagnosed within the comfort of their own home utilizing a home sleep study. Patients who screen positive for potential OSA and do not have complex comorbidities or don't show signs and symptoms of potential primary central apnea definitely can be diagnosed through home sleep testing. So it's really going to be able to open that option to the patient, present an option to the patient, and allow the patient to be diagnosed quickly and start therapy sooner than they would in potential labs. And really by bridging the gaps of the testing and the therapy, we're able to increase compliancy rates. The compliancy of therapy is a whole other topic, but we all know that we don't have the best compliancy rates of sleep apnea therapy, whether CPAP being number one, the compliancy is not very high on it, and there's multiple reasons for that. And we want to obviously think about the patient in mind. We want to give them the best shot. It's about, we want to put ourselves in the patient's shoes. If we are told to go to a specialist, the specialist is not open for 3 months, and then we then have to wait to see the specialist and then wait for a study, that patient is going to become frustrated. They're not going to want to go ahead and go through the test. Obviously, there's going to be other concerns when they get to the point of testing. But with that, we really want to put ourselves in those shoes. Think about yourself. You probably would not want to go through that whole entire process and be waiting 6 months just to find out something. So really bridging that gap, really that helps increase patient compliancy. And definitely it's going to help more patients be diagnosed. Again, it's always keeping that 80% in your mind, knowing that many people are undiagnosed. So we really want to be able to get more patients diagnosed. So as far as home sleep testing goes, a lot of you probably do home sleep testing in the room, which is great. And there's definitely a variety of options for that. You have the option to refer patients out to a home sleep testing company and allow them to take care of it through a mail order process. And so that way you're actually able to alleviate a lot of things from your plate. Or if you want to continue to advance in home sleep testing, you're able to bill for the study as well, or have one of the interpreting physicians perform the interpret. So definitely a lot of different options when it comes to mail order home sleep testing. But it's really about bridging that gap with the patient. And this in turn definitely will help physicians get more patients diagnosed, get more patients treated, because we're opening, you're no longer going to be kind of confined by inventory of devices, staffing concerns. Devices are expensive to acquire, especially a lot of the older home sleep testing devices are very expensive, and it's hard to have a lot of devices. I'm sure that if equipment and some of that nature wasn't a concern, we wouldn't really be we would obviously be able to get more patients tested and be able to move them through the process a lot quicker. So with that, you're really able to eliminate the inventory management of devices, having to own those devices, involved heavily in that process. Also with, utilizing mail order home sleep testing, it's going to allow you guys to do automation of communication of patients via email and SMS. We're going to be able to help drive that patient testing factor even more. You guys now, I'm sure, having to manually call the patient every time and pick up the phone and say, are you doing your test? Are you not? Are you bringing the device back to us? What's going on? So really, when you kind of outsource that and use different companies, they're able to really do that automation process for you. And we're definitely going to reduce patient barriers to testing for better compliancy rates. If we're doing just one type of testing, we're not going to be able to give the patient options. That patient may not ever do the study if they're not given more than one option. And definitely helping reduce staff workload. It can definitely be very taxing. I'm sure you guys would all love to be able to expand and how many patients you're testing. But it's really hard to go through the process with one patient from start to finish. So talking kind of about decision trees, there's definitely easy to use flow guides that can really help kind of, when you're coming to triage a patient and you'll see if that patient could potentially be diagnosed through sleep testing, say first, and in-lab study. And talking about sleep apnea evolution, so we see that technology evolves very quickly. We've obviously moved from in-lab facilities to home sleep testing. We've home sleep testing has been being done since the 90s. Was approved by Medicare back in 2008. And we really moved into, say, the level 3 type HST at that time. And now we've evolved into disposable device type options, devices that are not utilizing cannulas and chest belts and stuff of that nature. So, just like all technology, diagnostics constantly trying to evolve to be more patient friendly and less intrusive. So talking about some of the technology on the rise, because that is something that obviously we all see. HSTs have changed, they've gotten smaller, and we think that, this might present issues and concerns, but they do definitely offer many benefits. A lot of these devices are Bluetooth equipped. So with that, that's going to allow for the testing to happen a lot quicker. It's going to reduce the workload on your end as the devices are not having to be physically uploaded anymore. They're going to upload directly from the patient's home. So definitely going to be able to get the testing process a lot quicker and not, again, having to physically upload things. A lot of these devices are equipped with actigraphy. And with actigraphy, that's going to give us a total sense of sleep time. And with a lot of these devices, we will also be able to know how much REM time the patient got into. So we are knowing, one, that they got into REM time, and then two, knowing how much time of the total test, one, how long they worked for, two, how long they slept for, and three, how much time was spent in REM. So now we have disposable device options, and that really is a beautiful way to be able to make this process happen a lot faster, a lot more seamless for everybody. That is going to be not having a patient have to bring it back to you. You're not going to be chasing the patient down for the device to come back. These devices, because of the technology that they have and the apps that they pair with, it helps in a big reduction of failure rates and barriers to testing. Because the patient then sees how small the device is, how easy it is to use. They can pair it with their phone. People like technology; they're willing to do things that way a lot of the time. So it really helps eliminate those barriers to testing. Ability to perform multi-nights. We know when we have a patient in the lab, it's, we have them there for a very specific amount of time, and you're not able to look at multiple nights of testing. And with devices being so small and easy to use, you're going to be able to do multiple night testings for night-to-night variability. We know night-to-night variability very real thing. You can have a patient and, for various reasons, positional, drinking, whatever the case is, it's going to change your AHI. This way you're really able to look at night variability. A one-night study is one night. With this, you're going to be able to perform multiple nights. And then with a lot of these devices, it's very easy to then be able to perform follow-up efficacy studies. This is huge. We have a job to get patients screened, diagnosed, on a treatment, and we talked about briefly failure rates with treatment. It's really, we want to put patients in a way to know that we care about their treatment. We want to follow up with them, but we live in a world right now that's very hard to do with limited devices, limited lab expenditures, all of that. But with these devices, that helps really alleviate that and help for easy follow-up testing. Efficacy testing is one of the best things that we can do as providers to make sure that the therapy that we're putting the patient on is resolving the issue that they're having. We see time and time again where a patient, we find out that they're hypoxemic after the fact. We find out so many things after the fact, and we don't know why they're not staying on therapy. So really going to help with follow-up efficacy studies as well. So looking at it from the patient perspective, I always think we need to be role models for our patients. We have to keep in mind a lot of things. I know we all do it as people. We can give the best advice, but we'll never take our own advice. And so I think it's really important for those of us who, think about our patients, want the best for our patients, should want the best for ourselves. Be a role model. You matter as well. You need to care for yourself first and foremost, and really be able to live that to the death of the patient and make them feel good. Because if you're not feeling good, your patient can sense that as well. So please keep that in mind. I know you guys, a lot of you work nights. That's a very, very challenging thing to do. So it's very important to remember that you are a priority as well. But again, that's going to allow you to propel yourself and keep your patients first in mind when you're thinking about their journey and how you want them to feel. So it's really, you want them to look to you as a role model, as an expert in that. So really just keep them in mind. And take the time to explain the disease and the treatment options to patients. This is probably the first time that they've ever heard about this health concern. And we want to strike while the iron's hot. We want to be able to move the patient quickly through things, but we really want to keep them engaged. If we're not empowering them, they're not going to want to take part in their treatment. So it's really, take that time, especially patients that this is their first go around at things. That could be the world of a difference. I know, again, working nights, it's hard. You are trying to get patients in and out, but it's that conversation, I think, that you can really have with them and just listening to them. It's really going to help build that rapport. We know that the goal is to get them diagnosed, not go undiagnosed, again, encouraging them to keep following through. And how can we, what do our patients want or need? How can we help them the best that we can? And really, for one, like we talked about before, reducing wait times by utilizing various testing options. Patients will, like I mentioned, get frustrated and move on to other concerns. So really, when you're thinking about how a patient can be diagnosed, really consider all the options. And we know that faster diagnosis is going to lead to quicker treatment, which leads in turn to higher compliancy rates. That's what we want overall for our patients. And providing lower cost-effective options. Cost is the number one deterrent to patients, especially with what we're living in right now. It's very challenging for patients. We live in a very high deductible health plan world. We want to provide patients with the most cost-effective options for them, and not just run to the most expensive. So that is it for my presentation.